I'm Michael Wise. I'm 65 years old, and 3 years ago I suffered acute kidney injury, and I would like to describe my experiences, and I'll do that by going through several stages with you. There was the pre-acute kidney injury stage, the acute kidney injury stage when I ended up in intensive care, then a period of dialysis for 14 months, followed fortunately by a kidney transplant, and then the post-transplant period, which brings me up to today. Before the injury, I was extremely fit and well. Had a lovely close family life. I was jogging 6 miles 3 times a week. I was playing singles tennis once a week for 2 hours and playing mixed doubles twice a week for 2 hours at a time, and I felt extremely well and vital. I also loved my work. I'm a specialist in restorative dentistry and a specialist also in oral surgery, and I have a practice treating patients with extremely complex dental problems, and I got great satisfaction from helping them, and also the running of a team, which was really important to provide that kind of care. And the other side of my professional life was that I have a position as a visiting professor at the Eastman Dental Institute, which is part of University College London, where I teach, and I also teach privately. I just love passing on my knowledge to other people. I should start by saying that I suddenly developed a beta hemolytic strep septicemia, and it really is of unknown cause, but I could go through the events. On the Friday, I was ill on the Tuesday, and on the Friday before I had worked with a new nurse who apparently had an absolutely raging tonsillitis that I didn't know about. I would never have let her come into work if I'd have known, and so I worked with her on that day. The next day I felt fine. The day after, I took one of my grandsons to Spurs, and I wasn't feeling too great. I felt a little bit fluey, but nothing serious, and Spurs lost that day, so it made me feel even worse, but that was the way it was. And that evening I went out for a Chinese meal with some friends. I wasn't feeling well then, but I didn't want to let them down. The next day I felt quite a bit better, and I taught all day, but about 4 o'clock I suddenly came over feeling unwell, and I developed diarrhea, and I had to stop work, which I'd never ever done. And that night I sweated quite a lot, and I had some sickness, and I just thought I was getting the flu, and I had an upset stomach, which I thought maybe was related to the Chinese meal. On the Tuesday, I got up and I was very damp from the sweating, but actually I felt a lot better. And I treated one patient all day, a very complex problem, and I felt okay during the day. I certainly didn't have a temperature, otherwise I would not have carried out the treatment. But that evening I was due to take my team out for dinner, and I suddenly came over feeling awful. My temperature shot up, I started getting some tremors, and I started being sick. And I said to my wife, I've just got an upset stomach or the flu, you go and I'll stay here, it's not a problem. Well, during that night I was vomiting, and I had really severe diarrhea, and I started sweating terribly. And the next morning I got up and I thought I'd have a bath to make myself feel better, and I just couldn't get my leg over the bath to get into it. And it was at that time that Priscilla, my wife, got more concerned. She thought this isn't just the flu, but on the other hand it kind of looked like the flu or an upset stomach. So I had given her a list of things to do in an emergency, because by this time I was beginning to pass out and I couldn't communicate. And top of the list was to contact an intensivist who I worked with, who cared for my medically compromised patients. So she phoned him. He was a consultant at University College, and he said, I don't like the sound of this, I just smell a rat. I think you should call an ambulance and bring him in and I'll have people waiting for him, which she did. And when I got there, I was unconscious. I was taken into the resus unit and then pretty quickly into intensive care. Many memories of intensive care, and I think I'm just going to pick out some of the salient ones which I think are really important. Let me start off by saying that at no time was I scared or anxious. I felt totally comfortable and quite at peace. So they had me sedated nicely. But I should make people aware that I could hear what was going on. So I was deeply unconscious as far as everyone was concerned, but I could hear a lot of what was going on, and I did hallucinate quite a lot around what I heard, but some of it was absolutely crystal clear. I could also hear the music that my family was putting on for me, and I can remember very clearly Bach and Mahler, and so I was very aware of hearing. So when I come to what I could hear, one thing that I think is vitally important is that there was at one stage where I heard somebody say, I think he's had a stroke. And I have a cousin who I love very dearly who had had a stroke, who is really severely incapacitated. And I remember thinking, if I'm going to end up like him, I don't want to live. I don't know where I am, I don't know what's going on, I don't want to live. And shortly after that, the machine started alarming and they called the crash team in. And I know that's the sequence because one of my sons who is in television was keeping notes in case I ever survived so he could tell me what had happened. A time after that, and I understand it wasn't that much later, I heard somebody say, he hasn't had a stroke. And I can remember thinking very, very clearly, I don't know what's wrong with me, I don't know where I am, but it's not going to get the better of me. And quite unbelievably, after that, everything stabilized. The machine stabilized, I stabilized, and if you read one of the letters from one of the consultants, it said this patient was succumbing and miraculously there was a sudden turnaround. And obviously that was related to the medical care I received, but I have no doubt whatsoever that my mental state altered both situations. One put me downhill and one put me back onto the road to recovery. During ITU, I was obviously really unaware of where I was or what was happening. And as I say, I was hallucinating, coming in and out of hallucinations. But obviously the care I received was excellent because I was so comfortable and so at peace. But possibly as important, the care that my family received was superb. Apparently the intensive care nurses spent time with them, they explained to them what the machines were doing and the impact of different findings, and they were very kind and caring to them, as were the consultants who were looking after me. And I think that was really important because I was aware of my family being around me and I was aware of them being calm, and it would have been awful for me if I'd have felt a panic around me. I suppose it is pertinent to go through something else that went through my mind a lot in intensive care, and that is that I started off sort of teenager, early adult, being quite religious as a Jew, and I slowly moved in my views, and I would call myself an out-and-out atheist and evolutionist now. And that went through my mind when I was in intensive care because I said to myself, I don't know, as I say, I don't know what's happening to me, but I see no reason why it shouldn't be happening to me. I'm just an animal like any other animal, and things happen to animals. So if it's happened, and I'll just have to deal with it if I can. And it struck me that that was deeply consoling to me, as would be thoughts for people who were deeply religious, because they would feel comfort in that. And my mind went to the people who actually were unsure, because for them that must be a terrible experience. They don't know, they have no reason, and they must be thinking, why has this happened, and who's to blame, and what have I done, and all of those things. So I suppose they were deep philosophical thoughts going through my mind, but when I came to, I felt at peace with my understanding of the situation. If that's what's happened, well, that's what's happened, and I'll just try and deal with it. I've always met challenges head on and found them quite exciting, and you might think this is really crazy, but I adopted the state of mind where I realized I was a patient, and I thought, well, the shoe's on the other foot this time. It's going to be really interesting to see what the experience is like, and to observe what's going on around me, and to see what I can do for myself and my family to meet each challenge and try and move on from there if I possibly can. So the realization of being critically ill, it wasn't earth-shattering for me. It was just accepting the way it was. Well, if we talk about my realization that the kidneys may not recover, I suppose I ought to include a little bit more about dialysis, because when I came out of the London clinic, I was transferred to a corporate NHS clinic, which was a big clinic, and by that time I was much more aware of what was going on. And there it was a very busy clinic, probably a bit understaffed, so the nurses couldn't give a lot of attention, what seemed like a lot of attention to each patient. And my experience of dialysis was that I, at that stage, very, very sleepy, very cold, quite a number of hypotensive episodes. Now when I was getting off the bed, I might find myself on the floor. And 3 times a week, 4.5 hours on the machine, it was taking up a lot of my life, obviously keeping me alive. That was it. And it might sound trite, but again, I'd seen it as, well, here's another challenge, let's see how we can deal with it. And I say it sounds trite, but I have a cousin who is a paraplegic, and I've watched how he and his wife have lived their lives, and they've always made the best of everything. So, and that kind of runs in my mother's side of the family, and that's what I decided to do. I didn't relish the thought, though, of being on dialysis for the rest of my life, I must say, having been a very active person, dealing with complex problems in my work, needing a clear mind to do it. I was sort of faced with a situation where I'd lost my health, I'd lost my vitality, as I saw it, I'd probably lost my practice, because although I tried to keep it together, it had incredibly high overheads, and keeping the team together without me being there was very difficult, so I'd lost that as well. And being on dialysis would mean that I would continue to lose it, because I just didn't feel well on dialysis. So, yeah, I just hoped that I could get a transplant and see where we went from there. So I was transferred to another unit, because I was beginning to feel a bit better, and I thought maybe I could try and go back to work. So I went to another unit where I could get twilight dialysis, which then freed me up to be able to work during the day, part-time. And I did return to work part-time, and I found I could do the work. Didn't compromise my ability to do the work, but I couldn't do nearly as much as I could before, and I found I couldn't multitask. And the other thing I suppose I should add that was really important and stayed with me really only up until recently was that everything became surrealistic in the way that I viewed it. Everything was two-dimensional, not three-dimensional anymore. I couldn't get any depth in images that I was looking at. It was a weird, weird feeling. Also, I love music. I just could not listen to music. I love reading. I couldn't read. I play the piano. I could not play the piano. So I'd lost all those things. And that was difficult to come to terms with, more than the fact that I could either be on dialysis for the rest of my life or I was going to need to have surgery. Well, kind of the word went out that if anybody fancied it, I'd be very grateful to receive a kidney. And I was amazed by the offers that came in. Unfortunately, they were wrong blood groups, and although my family obviously were first on the list and with the new techniques could have been used, it wasn't ideal. But then, just out of the blue, the daughter of my wife's cousin came forward, and she was the right blood group, and she offered a kidney. And it's impossible to describe as a patient what that feels like. There's no way that you can describe it. But also, it's impossible to know how to thank somebody for that. And that actually, as a patient, is quite a difficult problem. You can't just say thank you. Gifts mean nothing. And I found that the only thing that I could do was to say to her, and sit down with her and say, there's nothing that I can say to you to thank you enough. You're giving me back and my family back our lives, if everything goes well. And that's an unbelievable gift, and we will always be grateful for it. But I just don't know what else to say to you. Yeah, well, I think it's, again, important to go through some of the transplant process. Firstly, there was whether my donor actually was suitable. So, it's a long, drawn-out process, quite rightly, to make sure that she really wants to do it, that she's fit and healthy to do it. But as a recipient, that's a very long and tortuous affair with lots of ups and downs, because each time she had a test, I had to wait for the result. And then each time she had the test, and Priscilla would say to her, look, this is all okay, but you're not committed. You don't have to go on to the next stage. And then we had to wait for her response. And that's difficult, but amazingly, every test she had done, she became even more convinced that this is what she wanted to do. But that was a difficult period to go through, really, not knowing what would happen. I spoke to the surgeon beforehand, and he was very, very helpful in describing, the sort of the technique. But remarkably helpful was spending time with somebody who had had a kidney transplant and a positive experience, and speaking to him was just so supportive that it was remarkable. I could really get on and enjoy life. I started playing the piano, I could listen to music, I could read, and I was exercising, and I was getting on my exercise bike 50 minutes a day. I tried jogging, but couldn't quite do that. I started playing tennis again, a little bit difficult with no toes, but I managed, and I don't think I'll get to Wimbledon, but I'm still playing a fair old game of tennis now, which no way of doing that on dialysis, and I couldn't walk. I mean, I'm walking 6 miles regularly. I go skiing, and I love the skiing, which I did before I was ill. I feel pretty vital, and I would put myself now at about 75% of how I felt before I was ill, which is just amazing. I'm not as well as I was. have to accept that. But I certainly can enjoy life. I decided to give up my clinical practice because my lease was up. I am 65, big responsibility, big financial responsibility. I have no overhead sickness insurance now that I'm 65. And I'd really achieved everything I wanted to clinically, and I decided I'd like to spend my time now mentoring and teaching rather than the clinical practice. And I've got the energy and the brain power to do that. And I wrote a textbook many years ago, and I have a desire to write another book now, which is based on my experiences and my experience of life and dentistry and all of those things. And so I can see how important it is for patients with acute kidney injury to get into the right environment with the right care as quickly as possible, and with limited resources, rather than wasting them with inappropriate care, that it would be much better to be able to have a system where people are getting the right care, which ultimately must be less expensive and also more beneficial to the patient. So I feel really excited about the prospect of this project and being part of it, and anything that I can do to facilitate it, I'm here, ready, willing and able. People say to me, what's changed since you've been ill? And interestingly, not a lot. What it's done for me is reinforce my core values. My core values in that, to me, my family are the most important thing. I live for today probably more than I did before. I was a big-time planner. I'm still a planner, but I still make sure that I enjoy today. When I hear people getting themselves all upset and uptight about things that really don't matter, I just smile at myself and think, you just don't understand what life's about. This really isn't important.